Okay, great, thank you. Now we'll move on to Washington County. They, as I mentioned, do not have the election of officers, but we'll have the establishment of the regular meeting time. For many years, our boards have met jointly. Well, hang on a minute. About that. Was getting a little feedback there and trying to get the live stream going. So for Washington County, we have the establishment of the regular meeting time, also at second Thursdays at 3 p.m. and a list of standing committee and subcommittee appointments. So do we have somebody, maybe Tammy, would you be willing to, we don't have our chair, Heather, today, at least not that I've seen. And would you be willing to entertain a motion in a second and conduct the vote?
Sure. And I tried to pay attention, but I lost it somewhere when you were checking the sound. So what we need is a motion for the time of the board meetings and to hold them together. Is that right?
Yes, we can do those together. Establishment of the time as the second Thursdays of the month at 3 o'clock. And then there is a list on the agenda of the various standing committees and subcommittees and members assigned.
Okay. Is there a motion for Washington County? See, Lisa, thank you. All in favor?
Aye.
Aye.
Any abstentions? Votes against? Okay, I think it's passed, Rob.
Yes, thank you very much. Okay, so we can move out of the organizational meetings. And now, Holly, do you want to take the lead here and call the regular meeting, the first regular meeting of the Community Services Board to order?
Sure. I'd like to call the meeting to order. It looks like the first order of business is to approve the minutes from the December 9th, 2021 meeting of the board. So if everyone had a chance to take a look at that, for Warren County, could I have a motion to approve the minutes from the December meeting? See Cindy, do I have a second?
I'll second that, Chris Hanchett.
Okay. Any discussion or edits about the minutes? All in favor?
Aye.
Any opposed? Any abstentions? Okay, minutes are approved.
Thank you.
Sure.
Okay, Washington County, Tammy, can I call on you again?
Yep. Can I have a motion from Washington County for the approval of the December 9th minutes? Lisa? Is there a second?
Mary Alice will too.
Okay, great, thank you. Any discussion or edits? All those in favor? Aye.
Aye.
Any opposed or abstentions? It's passed, Rob.
Very good, thank you. I'm going to suggest that we go a little bit out of order and go ahead, move right to the new business. Usually we do our presentations first just because, you know, sometimes the presenters might not want to sit through all of our business, but I think since our presentations today are internal, Linda and I are both going to present a little bit. we're going to move right to the new business, and I can introduce the first item, the Office of Community Services lease agreement. Most of you know we lease office space from the Warren Washington Association for Mental Health right there at 230 Maple. And we've been there for many years, 20 some years, I believe. And so our leases actually expired last year, and it kind of snuck up on me and it snuck up on the association. We do a 3-year lease. However, I did reach out to the association and they are suggesting this year to do a 1-year lease. They will get the building paid off at sometime in 23, and they just mentioned that they wanted to kind of keep their options open for that organization. So I'm agreeable to that plan. I may suggest to them a compromise of a 2-year lease to give us a little bit more comfort there, but I'd like to suggest a request that we get votes to approve an Office of Community Services lease agreement for either 1 or 2 years with the Association for Mental Health.
Okay. Oh, sorry, was there a question? Sorry.
I just want to say, I think I'll probably abstain because I'm on the board.
Was there another? I thought I heard another question. No. Okay. So if we're ready to vote for Warren County, is there a motion to do everything that Rob just said? All of that. All right. I saw Belinda's hand first. Is there a second?
Cindy was up.
Cindy was second. Okay. Any discussion? No. Okay. So all in favor? Any opposed? No. I know, Amy, you were abstaining. Are there any other abstentions? Okay. Motion carries for Warren County.
And for Washington County, can I have a motion to allow the Office of Community Services to sign a lease agreement for 1 or 2 years with the Association of Mental Health? Linda?
I'll make one. Yep.
Thank you. Any discussion? All those in favor?
Aye.
Any abstentions? Anybody opposed? Thank you.
Okay, our next item is the reason that we sent out an amended agenda. We have another item related to some additional OASIS funding for jail-based services. OASIS is providing $41,250 to each county. And I've had some discussions with the sheriffs and the jail administrators about the use of that funding. And in Warren County currently, both counties also receive from OASIS $60,000 for jail-based services, and that's been in place for a couple of years. In Warren County, we have a contract with the ACCA, the Addictions Care Center of Albany. And in Washington County, that $60,000 is part of the contract with BHSN. With the new funding, we've discussed with the sheriffs that a good use for that funding would be to support a program called the ABLE program. It's run by the Baywood Center. They've been operating this program in the jails with no funding for some time. It really was a part of a district project, and then there was really no true sustainability to it. The services in the jail are not billable. And so we've been looking for a way to sustain that program. The ABLE program is, I forget what the A stands for, but it's Alternatives for Better Living or something like that. Better Living Experiences, Alternatives for Better Living Experiences. And Amanda Zeno is the staff person that goes in. It's really a transition release. So helping people transition out of the facility into the community, connecting them with services. And each of the counties is agreeable to us initiating a contract with them. They, when we got the $60,000, they were not eligible at that time for a contract. They were in actually, you know, a bit of a, they had been, there was a lawsuit that was going on, and so they were not eligible for funding. As a parent, or they have a parent organization. We've always had a good experience with Baywood as a provider in our community. Jennifer Neifeld and Jackie Foster have been collaborative partners in many of our coalitions and meetings, and Amanda Zeno as well. So I would like to request approval to move forward and with contracting with them, because they have been approved now by New York State OASIS as eligible to receive funding. The issue that I mentioned has been resolved, and it had to do with a lien on a property that they had down in Altamont. The parent organization was 820 River Street, and there was a lien on a property that they were expected to pay off or something, and they eventually paid it off, and now they're eligible again. Okay.
Okay. All right, so could I have a motion to move forward with the OASIS funding for the ABLE program?
Absolutely, I would wholeheartedly support that.
Do I have a second?
I will second that here.
Awesome. All right, any discussion? Any further discussion? All right, all in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Okay, motion carries.
And is that funding just going through Warren County? I'm sorry, Rob, if you said that already, or do you need a motion from Washington County?
Yes, we do need a motion from Washington County. It's 41,000. Let me just get the number again here. 41,250 for each county.
Okay, great. Is there a motion for Washington County?
I'll
Lisa,
make the motion.
Linda, thank you. Any discussion? All those in favor? Aye.
Aye.
Any abstentions? Any opposed? We're good.
All right, thank you very much. All right, at this point, I think we'll move into the presentations. And Linda, I hope that you're able to share your screen there. We'll have you proceed.
One second. That didn't share though. Can you see it? Oh, you can. Can you? Could you see that? Did I just miss?
All right, share screen, yep. There you go. Now pick what you're sharing.
It's not. It's none of these.
What are you sharing? Okay,
It's showing.
yeah.
Okay. Can you? Everybody see that?
Yeah,
Am I off mute? Okay.
They can't see it, he said.
He said can't see it. Not yet.
You have to click share.
yeah, it's coming.
Looks like it loaded now.
Well, we had it for a second there, Linda.
Why is it not?
I don't know. You have to hit share screen first and then find it from there.
Right, but it's not showing up.
Close.
No,
Go to your files.
where?
Up here.
It's not it either.
Not in there even.
One second.
Show all your windows.
Where's that at?
That one,
It's not-
right?
No,
No?
Yep, yep.
that's not it though.
There it is.
We had it for
There
a
it
second
was.
again.
There. Where'd you go? Get out of, go back to where you were just at.
I didn't have this problem earlier.
Go back there. Share.
Now can you see it?
Nope, that's wrong.
Give it a second. Sometimes there's a little delay in it coming through. But
Find it
not
there.
seeing it.
How do I delete these?
Yep, it's coming.
That's not the
Could
screen
not
though.
see your application.
It says we are viewing Linda Wright's screen.
Okay, so now click on your PowerPoint.
So it's this one. Yes. Now can you see it?
Not yet. We're seeing a reminder. Community Services Board reminder.
Get
Maybe if you close that.
too many things open.
I know. I know. Here we go. Now, hopefully it will. Can you? I left shared. Okay. There we go. Too many things open. I apologize.
There we go.
Okay. Apologize for that, but thank you everybody for your patience. Just wanted to talk to you a little bit about Washington County System of Care Collaborative Partnership. And just kind of, we've talked about systems of care in the board on a number of occasions, and just wanted to be able to kind of update you in some of the changes that we've moving forward, how we've looked at systems of care. And we are looking at systems of care and as each county separately. And so right now we're moving forward in the Washington County, looking at the systems of care, and wanted to tell you a little bit about what systems of care is and the approach. So when we talk about a system of care, it is really a framework, and it is a designed approach to look at a comprehensive spectrum of looking at the services effectively supporting children and families and youth that are at risk of mental health or other challenges within their family. It is the design of a system of care is to be an organized into a coordinated network of caregivers, family, and providers and supportive services to partner together to bring meaningful relationships for children and families. And we strive to focus on keeping these services culturally and socially responsive in order for children and families to thrive in their homes, schools, and in the community and throughout their lifetime. A systems of care is incorporated not only mental health services, but promoting prevention, wellness, early intervention, early identification, and additional treatment to address the needs of all children and families. When we talk about this, we talk about it really as an innovative approach to planning, delivering services, and evaluating the children's service system as a groundwork of looking at meaningful partnerships so that it's beneficial to not only just a child and family, but also to the providers as well. This encourages us to understand the importance of meeting not only the psychosocial and developmental needs of youth in the contents of their families, but essentially knowing that the families are the components that promote health and wellness within their children. So when we talk about systems care and this framework operates under a set of core values and principles. And so in this slide, it identifies the core values and principles, and looking at our core values is keeping family and youth driven, community-based, and culturally and linguistically competent. And under those three core values, the expectation for systems care is to operate under these basic principles. And really, this is a philosophy of practice, and in hoping that all systems that are working with children and families will operate under this practice, operating under the values and principles, so that all services that are delivered and all interactions with an individual, child, or family will be under the mindset of these core principles, and making sure that all services are comprehensive array of services and that they have access to those services. We want to make sure that services are not only individualized but strength-based. A huge focus on evidence-based practice, meaning that are these services workable and doable, and will we see them supporting children and families to make positive change? Trauma-informed, least restrictive in the natural environment, the partnerships, again, in collaboration, and also looking at developmentally appropriate services. So right services at the right time is very much a key philosophy. And then making sure that all these services are equitable, not only looking at youth that have Medicaid, but are non-Medicaid, private pay, children that have gone through the DSS system, for juvenile justice system, regardless of what door they enter in, and they can access the services. The other piece of looking at the core principles is making sure that this is data-driven and there's accountability. So who is involved in the systems of care? When we talk about systems of care, we talk about key partners and making sure that we have the key partners. And as you look at the petal diagram, it looks at highlighting those systems that children may interface. Some may interface with multiple systems, some might only interface with one system, but generally they interface with more than one system at a time. Medical system, when you talk about children needing to go to the doctors, those medical providers, pediatricians are definitely needed to be at the table, as well as the educational system, as well as any of the other systems. We want to have youth at the table. We want to have the caregivers at the table. And so when we looked at Washington County, on the left side, I highlighted that our current key partners under our current systems of care for Washington County are listed on there, and which petal they represent. We do have missing partners, however, and when we look at our missing partners, that is falling into our developmental disabilities, our youth, medical field. We have two educational entities on our petal, but we would like to have more. We have 11.
Excuse me, Linda, I'm sorry, this is Tammy. Others might be seeing something different, but I'm still on the first slide, and I know you're talking about the petals, so I'm thinking we should be moving ahead.
Yeah, it's not in presentation mode. Like we're not seeing the slide. We're seeing you still in PowerPoint.
True, that too.
Thanks, Tammy. Now do you see it?
No.
Yeah, Linda, I think you'll get an even better screen if you click on from the beginning up in the top left corner.
I did do that.
Huh.
I think if it's projecting into another source, like inside the room, you're just sharing the wrong screen. What we're seeing maybe is your computer screen and not what you think we're seeing.
We did see that second slide for a moment.
Now
That's it.
there we go. Okay.
There we go.
Okay, technology, computer is not my friend today. So this was initially, that was just the definition of systems of care. In the corner, you see the map of Washington County. Washington County is very vast. that was the core values. And now this is the pedal. So is everybody seeing the pedal?
Yeah.
I don't know why you're seeing that. But, and I identified, those are the partners and the key partners that we'd like to have as partnerships. And when we think about, the other piece that I wanted to mention is when we talk about bringing these partners to the table, we want to have representation of all of this. One of the things is that we also want to look at is that each of these systems that we're talking about, not only family systems, have gone through transformation probably since 1960s, where we've talked about considering looking at who's the expert at the table and recognizing that all of these entities or all of these partners have experts, and how do we come together in collaborative approach to decision making. And so that's the whole focus, is looking at all of these pedals. Who are the experts? Who are the authority makers? Who are the movers and shakers? And how do we come together to make informed decisions, problem solve, and really actually keep our children and families at home and offer quality care while doing so. So here's another picture of who, again, we have at the table. We are looking to, like I said, continue to build. One of the nice things is we have Big Brothers Big Sisters, we have Glens Falls Hospital, Northern Rivers, our local DSS. So there are multiple providers that are at the table now. So what is expected from the group? And so when we talk about what is expected from the group, we talk about that although there are many people at the table, or there are some people at the table, the representation is of each person at the group is representing in the capacity of their partnership. So how are they viewed as on the pedal? And so the representation of the partner as their partnership. We also look for them to be able to continue to bring and continue to assess who are the missing people or the partners at the table, and how do we bring them to the table. We are looking for a continuous commitment for participation along, or if they can't participate, how do we bring somebody else along, because we're really looking at sustainability of the systems of care. Most of this is volunteer, and how do we work together and continue to support them, maintaining open communication and access, and then also participating in the decision making, that this is not a one show, one person expedition. It is definitely a framework that is moving forward to bring a philosophy of care to our system as a whole. So where are we now? We're talking right now with Washington County about building a systems of care infrastructure. How do we build that systems of care infrastructure? We had a systems of care action planning work group that was initiated with a group of individuals that were identified as the key stakeholders, and they came together in partnership to participate in this workshop, which was a 5-series workshop. We completed it in November of 2021. The outcome from that was that members that participated in the workshop reviewed and recognized the importance of a systems of care approach, and looking at how do we create the sustainability and creating an infrastructure. So how do we embed this into the work that we do day to day, when we not only deliver services and talk about deliverables, but also in the problem solving and the decision making on all levels. The one thing that we did recognize, that successful systems of care frameworks that go on in other counties have also identified lots of work that's been done with this. There were actually states that operate as a system of care state. And so as New York moves forward, we're looking to operate as a systems of care county. It requires commitment, it requires consistency, it requires diligence, but it also requires that we have involvement of our youth and our families at the table, along with our providers. Our ultimate outcome in the research has demonstrated that members have learned that the importance of a governing body, which is our building our infrastructure, really is typically comprised of 9 to 15 systems leaders. And those are the individuals that are the decision makers that make a commitment to and have the authority to. And ultimately, what we hope to gain from creating a system of care, but is not only educating and developing leaders that are in the provider industry, but also families so that they can advocate for themselves. Also youth, that they can advocate for themselves. They'll be aware of how policies are made, decisions are made, and they'll be at the forefront of that, and also look at cross systems collaboration. Why do we need a systems of care? Washington County members have found out that as we went through the work group, we noticed as we participated, we recognized that there were needs for additional services and support for children, youth, young adults, and our families. One of the needs that we identified was home-based behavioral health services were lacking. Outpatient mental health services were challenged by wait list, and parent support programs were available but not necessarily widely known. They were pocketed, and some people knew about them and some people didn't, and so the resource wasn't used and accessible by all. Also challenging was affordable housing and lack of transportation were noticed. The other, when recognizing this, we acknowledged the challenges that were presented, that there's staffing shortages and how it impacts on deliverables of services, but also there was limited in funding sources for services. In addition, participants also identified that there needed to be more collaboration. When we went through and we did a mapping exercise, people did not recognize that certain agencies offered certain programs. We didn't understand how we access some of the programs. Which door do you go into? When can they get it? When can they not get it? So those were all reasons why we talk about why do we need a systems of care, because all of that information would be shared and open and honestly more familiar to everybody, not only just the providers, but to the family. So lastly, when we talked about aligning with our system of care core values and principles, most of the time we recognize that we do them. But if you look down at the last four that I highlighted, on here were the ones that scored 2 on a rating of 2 or 2.5. So out of a scale of 5. 5 being that people were well familiar with and easily accessible. 2 meaning that we need some work to do. So evidence-based practices, making sure that what are the evidence-based practices that are out there and are they available for our youth and our families. Identifying and knowing what least restrictive and natural environments are, that was a challenge, and what does that mean? And so the clarification of that. And then also, again, developing appropriate services and support, so meeting the right service at the right time for the right individual, we're challenging. The last one that's on here, data-driven and accountability, had no rating at all because people don't, when we look at Washington County, specifically, because we're talking about that, there's no checks and balances to saying, are the services that we're offering, are they meeting the needs of our children and families? And if they are, how do we know they are? What is success rate? What are the outcomes? And so we don't have that currently built in. So that is something definitely that we might want to look at going forward. So where do we go next? So when we talk about where do we go next, let's consider the question of where do we want our systems of care to be and where do we begin? And so when we talked about that, we talked about the commitment and consistency in all key stakeholders. So that is the first area where we're moving forward and making sure that we can get as many key stakeholders and many representation from our pedal at the table when we're making these decisions. Organizing and developing a clear vision and mission statement. How do we get them on board and how do we stay on one accord? So by offering that clear vision and mission statement, we will be able to drive the systems of care work that we're doing. Looking to continue to do. This is not kind of one thing that will be a one and done kind of situation. It is a process over time. And as things change in the community, a pandemic hits, will continue to change as long as we go forth in our systems of care. So it is the process that is a philosophy of care over the time, continuously, always. And then we want to look at utilizing opportunities. So again, and in that utilizing opportunities, in November, the members of the Washington County Action Planning Group agreed to participate and were approved to participate in a 6-month learning collaborative with OMH through New York State. So in that participating through the collaborative is a 6-month process, but it'll allow us to continue to do some planning, some doing, some studying, some acting. So we'll continually assess where we are and that we'll move in that format. So our first goal is to build an infrastructure to create a formal structure to be sustainable. We want to make sure that our systems of care is sustainable, that it just doesn't die out with the people that are currently at the table. We want to be able to share that information. So continuing to look at key stakeholders, developing our mission statement, recognizing what our roles are and identifying the clear roles, and then developing a cooperative agreement. So ultimately from this and to build on that system here, we'll have an MOU between providers moving forward. So shortly after the Learning Collaborative, we were offered and we pursued a grant through New York State Systems of Care Expansion and or Startup Grant. In December 2021, at the end of December, Washington County was awarded $25,000 one-year Systems of Care grant for the year. So we'll be moving forward. So this will help to create that sustainability because there's some funding supporting that. Through that, we have our goal of building, not only solidifying our infrastructure, but we want to talk about awareness and education. And then lastly, we want to talk about service delivery. So access to that service. So in all of this, when we look at this and we talk about this, the last part I want to mention is that, I gave you my wrong email address. I'm sorry. It's right with an L. But before that, just wanted to share that how does this all fit into the big picture of looking at the board of Office Community Services Board and other boards as well, is that the focus is that not only will we look at those goals and objectives that we have, but our part of our accountability is to be able to respond back to not only Washington County, but also to the Community Services Board. We were looking at, we've paralleled and done some cross looking at what our local government plan is and being able to support and work with Carrie on answering some of the questions that she has and we have on our local government board, so that we can actually be able to begin to look at data. We've talked about getting some consultant work in as well to really move forward to make sure that we have a comprehensive plan that will be data driven, holding ourselves accountable and moving forward to support our children and families. So Janine Bickford has worked hard with me on this as well. And so she's our key lead from Washington County as from the DSS office. Any questions?
Yes. In identifying the individual needs, who does that?
It was a collective group when we did the.
These are the individual people that you're serving.
You mean the individual needs of the people?
Yes.
And identifying the individual needs, that'll be done on one level. So there's multiple levels. But however, we have parents that we're looking to participate and be a part of the Systems of Care Collaborative. So we do have one parent that's sitting with us and went through the workshop with us. We are looking to get more parents. We're looking to get more youth on board. And as we go through that, there'll be active participants and making the decisions, doing the problem solving, and then working through the implementation and responses.
So it's a multi-level plan of service that comes out of this.
It is not a service, it is a philosophy. So it's a kind of a twofold. Hopefully the expectation is that under the Systems of Care that it will support better services for children and families. So it won't be a direct service, but it's looking at how we do business and how do we do business that's sensitive to children and families, has their voice in being the right service at the right time so that they're getting what they need when they need it and not a month later. Sometimes we run into those experiences, or it's not the right fit, but it's close enough. And so therefore we offer that service.
So at the individual level, though, who will be monitoring the services and their success or not?
The focus is hopefully that the agencies will be monitoring their services as well as they'll be sharing with the Systems of Care approach, so that the work group and saying where we're at, the expectation is looking for transparency so that agencies will be providing information to us as far as a group, and then we'll be sharing that with other powers, the advisory group. We're looking at, we haven't given us a name yet, so the Systems of Care Collaborative Group will look at that, be able to assess where the gaps are, where the barriers are, and be able to say, what do we need to do differently? How do we need to do that? Getting more feedback, through surveys and data collection, which is something we don't have. Doesn't mean that we don't collect data, but we don't necessarily look at data to drive service planning. And so we're hoping that as we look at data to drive service planning, that we'll be able to meet those needs on a really basic level of the one-on-one services. Any other questions?
I have a
Linda, Sue
question.
has, yep.
Thank you. Yeah, I have a question because very, very interesting bunch of information here, but it's a little weighted towards OMH. And I'm just wondering how you see the interplay with Oasis. I know they're partners that you want to pull in, and we certainly have treatment providers who provide adolescent care in our community. Do you feel that in the long run will be collaborative and we'll look at the dual diagnosis issue for our kids in our communities, particularly in our school systems, and how that plays out?
Absolutely. I think not only, with Oasis, but also OPWDD, where we were looking really to get them on board as well, because we do have a lot of kids that have cross-system needs and families that have cross-system needs. And so really being able to support that on a equal playing field. And so although OMH is kind of driving this ship, Amy Secor is looking to present in a couple of weeks. Her and I have been working really closely together. We have Why We Connect in Warren County that's coming out of the juvenile justice system, but the same philosophy stands. And so how do we marry them together? They're very similar in lots of ways, but we don't want to leave any one system out. And so how do we do that collectively and supportively, so that becomes that one single entry, open door access to services, so that there's no wrong door, and that kids can get the services they need at the times they need it. Families can be familiar with and aware of. We have talked a lot about mapping as well, and Google mapping, and how do we share where the resources are, not only on like Warren County or Washington County's website, but how do schools have it on their websites? How do we use school-based services to be that focal point within each community? Because it could be very different from Whitehall to Hudson Falls, and what the resources are. And so how do we look at each of those communities and be able to meet the resources and gaps in each area? Utilize the resources and meet the gaps, sorry.
Thank you.
Any other questions? So we will have to report back with the money. There is a 6 month, after 6 months, we'll be report back on to OMH on where we are and the utilization, how we are doing with our goals. During this learning collaborative, we're reporting on how we're doing as far as meeting our goals and our objectives. And then we'll do a yearly report on that as well. And like I said, the expectation is that it will dovetail nicely with the local government plan. Thank you, everybody.
Okay, Linda, thank you for a very thorough presentation, and maybe periodically we'll have you coming back to give us updates. And I'm also part of some of the meetings with Linda, so we can both be bringing information back to the boards and keep the boards informed. But thank you again. I know you've been doing this presentation or similar presentation to various groups in the community, including school superintendents and that sort of thing. So I really appreciate all your work on it. Okay, I think if there were no more questions for Linda, I'm going to try to do a screen share myself. And if someone could indicate whether you're seeing a cover slide that says 988 implementation in New York.
Looks good, Rob.
Yeah, okay, so I'll try to go full screen here. There we go. Okay, so 988 is coming. This is something that last year the FCC adopted regulations to designate 988 as a 3-digit number to reach the National Suicide Prevention Lifeline and to provide rapid access to suicide prevention and mental health crisis services. The 988 number will become live on July 16th, 2022. 988 is a national initiative, so all of the states are working on implementation plans. In New York, there are no call centers currently in the Capital District or North Country regions. The national suicide number, the 1-800-273-TALK, the calls that come in from Warren and Washington counties are actually answered by a call center that's located in Suffolk County. The current hotline calls will roll over to the 988 calls. So actually both numbers will get you to the call centers for some period of time, and then they're going to phase out the 1-800 number. They just thought that 988, a 3-digit number, would be quicker and easier for people to use and remember. And for people that are reaching out looking for support, they'll be able to easily reach who they need to reach. So for 988 planning, the states are now attempting to build a 24/7 infrastructure and the needed crisis response services to appropriately respond to what is anticipated to be an increased volume of crisis calls. So the additional call centers will be needed in New York, as well as additional crisis teams and other trained individuals to respond to calls. New York State Office of Mental Health has indicated they're utilizing the implementation of 988 as really an opportunity to revamp and strengthen the crisis response system. There's some kind of, one-time federal dollars also available now, and so they're kind of pulling that into this and utilizing some of the federal relief funds that the Office of Mental Health had access to really kind of take a good look at the crisis response system for mental health related issues in New York. Also, the regional planning councils. I don't know if you recall hearing about this in the past few years, but sort of post-DSRIP or during DSRIP, toward the latter part of DSRIP, there were established regional planning councils throughout the state. But that funding ran out, and so the Regional Planning Council really pared down and has refocused their efforts in 2 areas: the children and family issues and crisis response. The RPC includes various stakeholders, including LGUs, and recommendations will be made to New York State OMH on these issues. They've established task forces for each of these areas, and they've also developed a sub-task force under the crisis response related to co-occurring disorders. Okay, so 988 in Warren and Washington counties, the Office of Community Services is involved in active planning discussions with both New York State Office of Mental Health, the RPC, and local stakeholders. We sort of straddled the Capital District and the North Country regions, so conversations are happening with my counterparts in both regions. Potentially call centers will be developed in each region, but we don't know that for certain. But I'm kind of following along with conversations and planning with each district or with each region, just to see what makes the most sense for our counties. And then in terms of strengthening the crisis response system, some new initiatives and changes will be taking place to strengthen the local system. Mobile crisis is approved for billing, and the increase in revenue will allow for increased coverage going to 24/7. The law enforcement addiction and mental health referral system, LEMRS, came out of the police reform discussions, and we will be implemented by the Warren Washington Association for Mental Health. Initially, they're going to do a pilot with the Glens Falls Police Department, and LEMRS will eventually be expanded to include additional law enforcement agencies within the counties. What LEMRS is it's an online portal or platform, very brief, one page that an officer can complete on the scene. get permission from the person, and that referral goes off to a coordinator who will then allow for next business day follow-up and outreach. Also, People USA is the recipient of a New York State Office of Mental Health Award for funding. That's approximately $245,000. It is one-time money, and it is a direct state contract. But this funding is to develop a peer mobile response and diversion system in Warren and Washington counties that can respond in the community, they can follow up, follow the individuals, and advocate within the court system, etc. This service will also be a billable service and allowing for sustainability. Parsons and Northern Rivers Mobile Crisis has also reported an increase in working in collaboration with law enforcement. And the Office of Community Services will convene a crisis response committee for periodic meetings throughout the year. This involves all of our local behavioral health crisis response entities and has also included some law enforcement agencies in our previous meetings. There was a district project work group related to crisis, and we felt it was important to continue that group. So even after district ended, we wanted to continue to convene our crisis response providers so that we could ensure coordination of those services. And then COVID hit, so we had a little break in the meetings, but now that 988 is coming, we'll be convening that group again. We will have 988 crisis system as a standing informational item on our meeting agendas throughout most of the year, just to keep board members informed of the planning and implementation as it progresses. People USA and Parsons Northern Rivers Mobile Crisis have agreed to do presentations for the boards in the first part of the year here. So we're looking forward to that and looking forward to hearing about the new grant award with People. Okay, I think that was really it. I know that was a brief overview, but again, as I mentioned, we'll just keep that as a standing item and keep the board members informed as things progress. Anyone have any questions on 988? All right, very good. I'm sure we'll be talking to our 911 centers as well. I think there would want to be a good connection between anybody that establishes themselves as a call center with 911 system as well, because obviously some calls that may come through would be life-threatening emergencies where we would want to involve law enforcement, get them on the scene. But you know, we'll be sure that they're included in some of our discussions and planning. Okay, if there's no other questions on that, I just have a few informational items on the agenda. I wanted to keep the boards informed about the Adirondack Peer-to-Peer Veterans Peer Support Program. We had gone out to an RFP in December. We did receive 3 responses to that, one from People, one from the Adirondack Vets House, and one from SUNY Adirondack. We pulled together a selection committee, and some members from this board have volunteered to participate, so I thank you for that. And Amy, I still need to get back to you as well, which I plan to do. We ran into some delays over the holidays, and then there's a change in the committee leadership at the counties, and the counties wanted to be involved in the selection. So we're kind of waiting for the counties to settle their committee assignments and committee chairs and make some decisions on who they want to have involved in the selection process. For those not familiar, the Adirondack Peer-to-Peer Veterans Program is a funding of $185,000 that the 2 counties receive. The funding actually flows through Warren, but it's specified to be utilized as for a program as a joint county program. Currently, it's housed at the veterans offices, and they are currently without a coordinator. So when that person vacated the position, there were some discussions with the county, and it was determined we would go out to an RFP. It might be more flexible and feasible to operate have an agency operate the program. Okay, and then I guess I'm going to turn it over. Is it Crystal able to speak to the 2022 CSB Member Code of Ethics form?
Yes, I can now. Hi, everybody. So attached in your packets, I did include the Code of Ethics form. We do have a request that you sign it and to give it back to us every year. If there are any abstentions that you need to have, such as Amy with the one, please write that on the back. Sign and date, either send it in the mail, email it, fax it, however you can get it to us is better for you, is good for me. Also, I do need for the 7 total new people that are here, I need updated contact information such as your address and your home phone numbers so that I can send you out the new member packet book. I can actually send it through email if you'd like to. But I just need I need you guys to send me an email with your address and phone numbers so that I can contact you for anything that we need right away.
Thanks, Crystal. So a number of years ago, the Code of Ethics form was developed. We asked the Community Services Board members to review it and to sign off on it. And then on the reverse side is a place to declare if you have any potential conflicts of interest. So we asked, it's a two-sided form that you look at both sides and sign both sides. Because we do have a number of new members, I think I would be reaching out to the new folks and offering an orientation session just to go through that new member board book and kind of, you know, gives an overview of our office and the agencies we work with, the funding, how it comes and who it comes from, et cetera. So I'll be reaching out to the new members. Amy Secor in Warren County will be joining us. She's not actually appointed yet, and she's not able to attend a meeting until March, which ironically, she's also scheduled to present that day on the Y Reconnects. So for her first meeting, she'll be one of our presenters. And I'll get her appointed through the next committee cycle here, so she'll be appointed by then. Okay, does anyone have any additional items or updates?
I just have a question. I was looking for that code of ethics and I might be missing it. I don't know if you could resend it or if you could just tell me which email it was in. I'm looking at the January 6th and I don't think I see it.
You know, just to make it convenient, we'll resend it.
Okay, thank you.
And we'll put the code of ethics in the subject line.
Okay, thanks.
Okay, one thing I didn't do was have any of our guests introduce themselves, or if they hadn't wanted an opportunity to say anything. We had a number of guests with us today. So I would open the floor up if any of our guests want to introduce themselves or want to say anything about their work and their agency. Okay, hearing none, I guess we'll go ahead and move to close the meeting. So Holly, could you entertain a motion to adjourn?
Sure. Can I entertain a motion to adjourn? I think someone raise your hand. There we go. Cindy. I think I need a second, right?
I'll second that.
Okay. I don't think we vote though, right? I think that's
No,
it.
I don't think we do. I don't know if we're doing it quite right, but yeah,
All right,
I think that's sufficient.
Little rusty on my Robert's rules, but Okay, motions or meeting's over, I guess. Goodbye,
Yes.
everybody.
Thank you.
Thank you, everyone.
Thank you, everyone.
Feel better, Rob.
Have a nice
Thank
week,
you. Thank you.
everybody.